So first impressions are very important. Please be aware and come to impress your preceptor. It goes without saying that you're going to try to arm yourself with a lot of knowledge. You're going to be studying a lot. You're going to be studying every day, both for each rotation that you're in and also to prepare for the ultimate test, step 2 CK. Now, with that being said, you should also add to that list learning the generic versus the brand names. When we were in school and during our first 2 basic science years, we learned all the drugs under their generic name. While we do use it a little bit during our clinical settings, now they typically use the brand names. This is something that's a struggle for everyone and is going to be a constant struggle, but we have to work at it and so that we can get a little bit better at it every single day. Now, with that being said, besides your knowledge and besides studying hard, what else can you do to make your first impression great? I'm talking about bringing a positive attitude, the ready-to-learn attitude, and also a ton of enthusiasm. You can demonstrate these traits by being active learners and, more importantly, ask very thoughtful questions. It's easy when you're seeing a very cool procedure like a thoracentesis, and you can ask like, ooh, how do you puncture that, or what equipment do you use? But think about the questions that you're asking your preceptor a little bit more. Make it a little bit more thoughtful and correlate it with the medical condition itself. So that way your preceptor can see, wow, they're really putting some thought into it and they're really thinking about the patient as a whole and not just, you know, a very first level kind of question, very basic. They like to see that. They like to see that you're curious about the profession. They like to see that you're interested in the procedures. This makes them more excited to teach you because there's nothing more mundane and more boring than teaching someone that barely even wants to hear the words that are coming out their mouths. So next thing is, I would suggest for you to always volunteer to help out the team, help out the medical staff, help out your partner. Say you're better at suturing than your partner, why don't you just help them out? These are opportunities for you to improve yourself as a leader and improve yourself as a good partner, because in healthcare we all work together as a team, and it's important that you start to hone these skills at this point as a young doctor in training. Another thing I want to emphasize and bring up is whenever your preceptor offers you an opportunity to get hands-on, your answer to that question, and there's really only one answer to that question, and that answer is yes. You always say yes. Even if you're nervous inside and all the butterflies want to come spewing out your mouth and your ears, just kind of keep it down and say yes. And why do I say yes? If this is your first offer by them, it could be your last. They offer you this opportunity because they believe in you. They believe that you might have the potential to be able to do this. They want to give you an opportunity to learn. Once you say no, they will keep that in mind, and maybe they'll give the offer away to your partner or to another student, or just never to offer it again because you're too afraid to accept it. Even though inside when you hear this offer, so for instance, putting in a trach, right? I was offered to put in a trach, and I was able to say yes to it because, of course, I am worried, completely worried about, am I gonna cut the wrong artery? Am I gonna put it in too hard and then damage the patient? So all of those things go through your mind, and that's completely normal because you care. You care about what you do and how you perform, and you should. However, you do not say no because you have these doubts. Why? Because your preceptor are professionals, and these are their patients. They are fully aware that you don't know what you're doing and that you are trying your best to perform better and learning from this experience. So they're there to guide you throughout the whole time, and they would never ever let you harm their patient. So next time when your preceptor gives you an opportunity to do a procedure, the answer is yes, and it's always yes. So with every rotation, you're going to rotate during your third year or the first time you're starting with third year. You'll be met with a lot of mixture of excitement, nervousness, and of course, some frustrations. And for me, to reduce the latter, I always try to prepare as much as I can. So as soon as I know my schedule rotation, I do some of the following. Number one, I look up the distance to the office and plan my route. Like I mentioned earlier in the video, you always want to Google Map search the directions and allot the correct amount of time you need to get to your place on time. When you get your schedule, you scroll all the way to the bottom. What you'll see there is the name of your doctor with their phone number and the address. And that's the address that I use to look up the distance and plan my route. Number two is with that phone number that's written on the bottom, it can be one of which way. So the number can be their direct cell phone number, or it can be the office number. If I'm lucky enough to get the doctor's cell phone number, I start with inputting it into my phone, and then that Sunday before I start my rotation, I would send him a group text from me and my partner to, one, introduce myself as their new set of students. Number two is to find out when and exactly where they want to meet on Monday. Even though you're meeting at St. Francis Medical Center, it does not necessarily mean you know exactly where to meet. So it's really important for you to get these very fine detail down and ready to go the Sunday before you start on a Monday. If you get an office number, this makes it a little bit different. If you're able to get your schedule ahead of time, I would personally call the office on the Friday before I start. That means you'll be calling during your current rotation. If that's not possible for some reason, because you may not have it early enough, what you can always do at this time is to contact your clinical coordinator. They will have historical data as to how previous students have managed to get in contact and when and where they usually meet on their first days. Your clinical coordinator will be very helpful at this time. So make sure if you get an office number for a doctor, that's what you do first. And last but definitely one of the most important part to add to how you can impress your clinical preceptor and just to come into it a little bit more confidently is I personally would start to review some high yield topics for that specific rotation. And luckily for you, you can review your clinical clerkship guide for students by students. What I've done is I broke down high yield topics for every single rotation. You'll have OBGYN, internal med, surgery, etc. So go to that section, look at the different high yield topics and read up on it, look up some videos. If you're going into a rotation that is very procedure heavy, such as OB or surgery, or even internal med, because sometimes you get to do some fun stuff. I personally just start looking up some videos because I love getting hands-on. That way I'm now more aware of how the doctors would usually perform the surgery and how to tie a suture, because one of the first things you get to do is to tie a suture for a first time. Like I said, you want to always say yes when you're given these opportunities, but you want to have a little bit more background. By doing this, you're going to impress your preceptor and your attending, because one, they might not expect you to know all this stuff, but if you already know or even have some knowledge of it, it makes you look very good. So oftentimes us medical students are known to be very competitive and very type A, which I think is really great. But just remember, don't lose sight of who you're actually competing with while you're on your clinical rotation. You should remember that you're really competing with yourself and not with your partner or with the other team member. So with that being said, please don't play dirty. Please don't do things to make them look bad, and that way it can enhance your image. Because these little tips, these little dirty tricks, it really is very apparent to your attending and your preceptor and your clinical coordinators. Remember that while you're rotating through your various specialties, you're kind of conducting yourself as if you're going in for an interview for these specialties and with your doctors. And one of the most important thing is you're trying to procure some strong letters of rec. Would that kind of attitude and those kind of behavior be something that you really want your attending and your preceptor to know about you and to note on your LOR? Well, most likely not. So be kind and flex your dominance and flex your knowledge in a different way. Perhaps flex it by being an effective leader, and that way they can see that and they really appreciate a student that can work well with their teammate, because this is something that they will take note of and they will note that in your LOR. And as young medical doctors in training, we are going into a very toxic system already, where the tier can be really harmful to our emotional mental health. I would suggest that we young doctor go into it by changing the toxic system and add positivity to it, and not adding to the already negative and corrosive system. Please come into it, be positive, be a team builder, and not be selfish and think about your own personal growth when there's so much that we can do as a team rather as an individual.